Welcome to Airway Answers, expanding your breadth of knowledge. My name is Nicole Goldfarb, and I'm a speech-language pathologist and certified orofacial myologist. And I'm here to help you find your airway answers. We're in this together. Let's do this. Hello, everybody, and welcome to Airway Answers. I have the amazing Dr. Kalli Hale here. Welcome, Kalli. Thank you so much for being here.
Oh, Nicole, it is such an honor, and I am such a huge fan of yours. I look forward to chatting today for sure.
Oh, so fun. Well, I'm a fan of yours, and I will tell everybody how we met, which is really fun. So I will do a little information about that in a minute.
Please do.
And I appreciate you spending your time because I know you're about to fly to Raleigh for the Invisalign Summit that you're speaking at. I mean, people like you are absolutely amazing because you're on the go all the time, spreading the airway message everywhere. And you literally fit this interview in before you're about to go fly to do another lecture.
Okay.
So thank you so much. So today we're going to talk a lot about Toothpillow, which I've heard you lecture on quite a few times. And I think in some ways it might be misunderstood. So I want to really help our audience learn about what Toothpillow is, what the mission is. We'll go over a lot of details about that. And also you are just such an airway advocate that I want to start out by asking you some sort of personal questions on your thoughts and views on different airway things as well. So
love it.
I do research whenever I interview people. I don't just think of questions, but I spy on you and I go to your website and read all this stuff and I look at all your other interviews. So I want to say a few things before I do your bio. Toothpillow, the slogan is your virtual airway dentist. So we're going to go over that a lot today. On your website, one of the philosophies you have written, it says preventing problems, saving lives. Our philosophy, our mission, and this is at your dental practice, our mission is to rid the world of sleep disordered breathing. That's just enough said, right? That's what we're all.
Thank you. Yes.
And the fact that in many ways this is a preventable disease is really important for everyone to know. So we're going to talk about that. Let's go over your bio so everyone can learn about who you are, and then we'll get started on our conversation. Dr. Kalli Hale is passionate about how our teeth affect our systemic health. Her training in obstructive sleep apnea has transformed both her personal and professional career. Dr. Hale works with dentists around the country to develop clinical protocols for the treatment of mild to moderate obstructive sleep apnea and sleep disordered breathing. Her work in pediatric expansion and sleep disordered breathing catapulted her speaking career and lives by the slogan, "We have to start getting it right for our kids." Kalli is the co-founder and chief clinical officer of the Airway Dentists, a group of practices in Houston dedicated to ridding the world of sleep disordered breathing. And she is also the proud founder and chief dental officer for Toothpillow Incorporated. And also you have your own podcast, the Sleep Well Journey podcast. Is that correct?
Yes, thank you.
You do a lot.
And so do you.
As a dentist, are you a pediatric dentist or general dentist?
General dentist by trade, just a lot of airway training. Yes.
Okay. And I know I saw you posted recently too that you opened another office. How many offices do you have?
Yes. Oh my gosh. So the airway dentist is such a big passion and heart of mine. We started this 3 years ago and we had 2 locations that were running and gunning for a year or two. And then our executive team grew. We hired a CEO because we were like, we really want to saturate all of the world. That would be great, right? But definitely Houston. So I have an office in Friendswood and Sugar Land, Texas, and Atascocita, Cypress. And we are soon to open 5 more by February of next year. So my life is just absolutely chaos right now.
Holy moly. So wait, how many is that? Currently you have how many offices?
So right now we have 4 that are open and seeing patients, but we have 5 more that are basically under construction and going to be ready by February.
So 9 offices.
Yes, wow. It's crazy. Yeah. And my biggest role there not only is training the dentists, which is the biggest thing for me, is I want to be there for them every step of the way. but we have doctors that are applying and wanting to know more about what the airway dentist is and how they can be a part of this mission with us. And it is the most beautiful thing. We actually have a dentist who's uprooting her family and moving from North Carolina to come work in our soon to be Woodlands location. And I'm obsessed with her. She's the sweetest, but she was like, this is the time for me. And North Carolina is actually not very friendly for home sleep apnea tests and airway treatment in general. So she struggles to be able to do what her passion is in frenectomies and all of that in her state. So she's picking up and moving to Texas.
That's amazing. And my favorite sleep doctor, Dr. Simmons, is in Texas as well. I know he has an office in Sugar Land. So that's a really
Mhm.
great location where you are. And also the name of your practice, the Airway Dentist, that just draws people in because that's what you do. That's who you are. And that's just amazing being able to spread that message by being able to help so many different people by having so many different offices and training.
Thank you. Yeah. Well, I mean, it just became impossible in my one location where I still see I'm finishing out cases. I'm phasing out clinical, which is very weird for me. It's been a very interesting journey this year of finishing out my cases and cutting my days and train somebody else to take over where I am. It's all beautiful. It all works out, but it's just something you don't know is coming until opportunities like what has happened in my life start to arise. And then you have to figure out what are you supposed to do, and with these words that you have and I have in this passion for spreading the word. So it's been a really interesting journey, but I love it. I'm very thankful for it. And I do think it's what I'm meant to do. So
Oh, you for sure are. And so I met you, it was 2024, and I think I heard of your name before, but at the AADSM, the American Academy of Dental Sleep Medicine conference, that was in New Orleans. I was speaking at the day before the conference. It was an all-day pediatric obstructive sleep apnea day with Dr. Ghazal, Dr. Yoon, Dr. Lagmame, all these different amazing people. And I was like, oh my God, I'm talking with them. I felt like,
I was so proud of
wow.
you.
I was like, I got to do this. And I listened to the recording recently, and I'm going to play a little
Mm.
clip because you're
Okay.
amazing. And then I see you at all different conferences, and you are the lady that stands up. Either you raise your hand or you go up to the microphone and you will ask whatever question. You are not shy. You speak your mind, and I love it. I
Thank you.
remember after I spoke, they took questions, and you were the first one to come up to the microphone, and you said, freaking good job on the microphone to me in front of like 300 or more
Absolutely,
people.
I did.
I was like,
Absolutely, I did.
wow, that stuck with me. If I ever get nervous for
Mm.
speaking, I actually think of that.
I'll just come sit in your audience every time, okay?
It's
And then I
fun.
can just
It was so awesome. I have to play this because also you had a really good statement after. And so I recorded my screen so we can listen to what you
how
said.
exciting.
Let's
I
just,
like blacked out, so I don't remember what else.
yeah. And I replay that in my head all the time.
Oh,
Okay, so
I
let's listen.
love it. I love
Here
it.
we go. Let's see if this works.
Hi, I'm Kalli Hale. I just wanted to tell you, freaking good job.
Thank you.
This was amazing.
Thank you.
And I wish half of these studies had been talked about an hour ago. I think we have myofunctional therapists in all of our offices. We're based out of Houston, Texas. It is a game changer for your orthodontic patients and your sleep patients. And I think we need to remember, this is my personal opinion, it is the kids that suffer if we are waiting for a perfect clinical trial to prove this stuff. And they deserve better.
Okay, did that work?
I heard it perfectly. And I was wondering if that was recorded because I'd never heard it. So I appreciate you replaying that.
Isn't that great? I just got chills. It is the
Me
kids
too.
that suffer. And before I presented, there was another presentation that went over position statement by the AADSM, the pediatric group. It was about 15 people who put together a sort of a consensus or a position statement evaluating different treatments for pediatric sleep apnea, whether it was tonsil and adenoid removal, rapid palatal expansion, tongue tie release, looking at them all as monotherapies and saying, what is our consensus? I think we were all just like crawling in our skin listening to this because everything was doesn't work or we can't determine, undetermined. And then I went and presented after all these studies showing when it's not monotherapy and we combine the treatments because treating sleep disorder breathing is a holistic treatment. There's
Absolutely.
no one answer. But
Oh my
when
gosh,
we
yes.
right? And when we
Yes.
combine everything and add myofunctional therapy, we can really treat this problem, and we've got to treat it early. So that was kind of how that conference went. Do you remember that?
It was. I was just like literally crawling out of my skin. I felt bad for my friends who I was like, you got to come because it was called the Pediatric Debate Day and it cost more than the conference. Like it was an adult, remember?
Yeah.
And as soon as I heard it was happening and they called it a debate day, they advertised it like that until the very end. And then they didn't call it that. I don't know if you remember that, but I was like, a debate about peds, I'm there. Like, I want to be her. Like, let's go. And when the other people before you were talking, and I couldn't have disagreed more with what they were saying, I felt bad for my friends that were with me because I was just like throwing my pen down and like, I just can't help it. The people that are talking about it are not obviously treating it like we are because we get such wildly beautiful results. And then you went up there and just mic dropped it. And I was like, I got to get up and tell her what a great job she did.
That was stressful and intense. And thank you for your support and your comments.
Of course.
And one of the things, as I was researching about you also, is you have your own podcast, and I see on Instagram and different social media.
Yes.
And other people interview as well. And a few things that you had said is collaborative care is the ultimate goal to achieve. Seeing both an airway center dentist and an ENT specialist can help understand the proper route in maximizing your craniofacial growth and development, as well as your airway. So we're talking holistic care. You did an interview how to avoid braces, fix tongue ties, and stop mouth breathing. Avoid braces for kids. Focus on jaw development and breathing. Tongue ties, ADHD, bedwetting, and mouth breathing are all connected. So that's something people should look up. You did an interview with Mike DeLuke, Dr. DeLuke. We have to stop getting it wrong with our kids. And also function first. This was a different interview. What everyone gets wrong about Toothpillow. We're going to talk about this. And do it right the first time. You said it's all about the kids. You've been told your kids just need braces, but what if the real issue is airway? So you are a passionate airway advocate, and I want to know, how did you get started with the airway minded passion and thinking along airway terms?
I had such a gradual transition. I look back now and I can't even believe I treat pediatrics. Like I wanted nothing to do with peds when I got out of dental school. And I was really like all the education that I was doing and learning about sleep apnea was because we were in a very heavy restorative practice. I come from a family of dentists. I'm one of five, my immediate family. My dad just retired after 45 years. And he was a big time implant dentist, had his own courses. I did a residency with him. I was placing implants, and we were just having issues with bruxism, abutments breaking, crowns breaking, like whatever the situation was. And it's like, why is that actually happening? And I always had kind of an underlying desire to know root causes for things. And in dental school, I went to a very great dental school, but everything was just, if they're grinding, pop a night guard in their mouth. There was no, well, why are they grinding or whatever? And my younger sister is a full-on biologic dentist in Austin, Texas. She has a beautiful little practice and she spends so much time researching. And she actually started planting the seeds for me with a lot of this stuff because I was just busy in the trenches working like most dentists. And so she started like telling me like, hey, I think it could be this or that, it could be nutrient deficiency, it could be sleep, like whatever. So I found a company that would mail patients a sleep study. This was way before I had my own machines. And I was just like, okay, look, you're grinding. I've heard that could be sleep apnea. And then the patients would usually say, oh, well, I mean, I'm snoring. My husband says or whatever. I'm like, okay, this is interesting. I'm really just putting the pieces together. It was like my own little trial of like, is bruxism truly going to come up with some sort of sleep disorder breathing on a sleep study? And so I started screening that way and I was catching it left and right. And then I was like, what the heck do I do? Like, I don't even know what to do with this besides send the patients for a CPAP, like send their physician get a CPAP. I wasn't doing any orthodontics at the time. I didn't know. I was just not who I am today for sure by any means. But that is how I think most of us start is, okay, we've got to learn more about this. So I started taking courses and I was just completely enthralled. And when I got to some pediatric training, I, just like I'm not afraid to get up the mic and ask a question. I was like sitting front row, listening to some ortho lectures. And I was like, this is absolutely insane. And I'm like, if this is real, because again, I'm like, how did I not learn this in my pediatric rotations? Then we have to do this. Our biggest mission should be this. We learn how to do sealants in pediatric rotations. I mean, we should be screening for sleep disorder breathing. You want to make sure I can perfectly isolate a sealant, but I can't understand this kid is grinding and maybe having terrible oxygen issues at night. That is what needs to change. And so I just hit the ground running. I kind of started a small amount of cases in 2018 in pediatric, and I was just feeling it out with some really sweet patients who knew me and trusted me, were like, hey, we'll try it. Did it for like nothing. And then by the time 2020 came, I mean, the world shut down for a little bit too. I was completely on fire. Every single patient got screened. I did over 200 cases that year in pediatrics, and it changed everything. It really changed everything. I look back on that, I was like just stressed and learning and reading and drowning in patients and wondering what to do. And I really didn't have a lot of help or people to ask then. I was just learning it on my own. To now I teach it and I love it. And it's just been a wild ride, and our kids deserve it. And I used to be very timid to talk about it. I lost a lot of colleague friends in 2020 around here that just the target on Kalli Hale's back with these guidance appliances that nobody knew how to use or knew what they were doing was very large. And after I started having the successes, I just didn't care anymore. I'm like, there's nothing you can say to negate how well these work. I've treated thousands of children. They have their limitations, but they're such a beautiful adjunct to our treatment for phase 1. And then my hygienist got trained in myofunctional therapy. Anyways, it was just a beautiful, that's kind of a little background for me.
Wow. And that's when our curiosity and our need to learn
Totally.
more, because once you see it, you have to go down that route because you can't ignore it. It's a
Absolutely.
calling. There's no choice, right? You
Right.
overwhelmed yourself with the education. And I find a lot of people discover this airway aspect either from family members themselves or patients having airway issues, sleep issues, or a lot of dentists find this with their patients who are bruxing, and they
Yes.
are curious, why are they bruxing? And that always leads down that airway route, is that curiosity. So
Yes. Right.
finding that root cause, and I'm taking notes because you keep saying amazing things. Our kids deserve it. They do deserve
Yes,
it. How can we
they do.
ignore this? How can we ignore
Yeah.
that? This is not
Yeah.
okay. And you said you got started doing in pediatrics guidance appliances. Can you talk about
Mhm.
what guidance appliances are and what that means?
Yeah, I like to tell people these, I term them broadly like habit corrector appliances. And if you're new to Airway, you'll see there are many brands. There's MyoBrace, which I love, Vivos Guides, which are my go-to, Healthy Start. There's a lot of wonderful appliances for growing mouths, and they are literally gold. And I am rather brand agnostic. I teach a lot of dentists on how to use these, and I really don't care what you use. Just please use them. Please start working on the children's musculature and get them breathing through their nose. And nothing is easier, truly, than these appliances that they put in while they go to sleep at night, especially when they're really little. So there's a whole array of them. And for anybody that's interested, Google those 3 brands. You can message me, but they are the most powerful growth and development tool I think we have in our hands for patients that are low cost and aren't going to do any harm.
Okay. And so these are all growth guidance appliances that are removable. And did you say the children just sleep in them, or do they also need to wear them during the day?
For the little babies, we just want them sleeping and them getting used to it. Sometimes if they can't sleep with it all night at the beginning, like my son, I started him at 3. It was probably 6 months before it stayed in all night. We threw a little morning party. We were so excited. But we do like to have daytime wear, active wear. When the 3-year-olds, they'll chew them up a little bit. So I try to tell the moms, take it slow right now, just to wear it while you're sleeping. In the older children, we definitely have appliances that require active wear 1 to 2 hours a day, actually, plus the overnight time. So yes.
Okay, and why would you use one of these guidance or habit corrector appliances versus maybe a traditional palatal expander or something like that?
Yeah, age and severity. So I get that question in my DMs a lot. Does my child really have to have expanders? Can we just do a guidance appliance? And it's so patient specific. The way I teach expansion to the doctors that I've helped is actually using them together. And I know that I've seen some lecture material from Dr. Yoon, and I know that that's also starting to become a little more popular. But the guidance appliances, the starter appliances, Healthy Start, Vivos Guides, MyoBraces fit over the expanders really well. And so just pro tip for anybody watching this, it will help to start the nasal breathing conversation and change earlier in the expansion journey if you have that. And it also, I've sleep tested children with and without these appliances. noses, and the ones that do have apneic events and high RDIs have incredible results because the appliances are holding their little jaws forward in a class 1 position. So if you've got a real deep bite class 2, these are gold and you're not chasing them with orthodontics.
Okay. And then what about when they're sleeping? Because these appliances can be bulky. Do you
Yes.
utilize mouth tape, or do the kids tend to open the mouth? Do their jaws drop back? How does that work for that
Yes.
nighttime wear?
Yeah. So I try to stray away from taping until I'm really confident that that child can breathe well through their nose. Except I love the bio tape. I love the round tape that has the hole in the middle. So no parents are concerned, that something bad's going to happen or whatever. In the beginning, in my experience, you will see the guidance appliance in the child. So their lips are not fully closed. They are breathing through their nose though, and they are not snoring, and their tongue is up. So it's not blocking the back of their airway. In all of my children and patients that have been in for 3, 4, 5 years, their whole musculature adapts over that guidance appliance. Like I have to go in now with my kids and I like stick my finger in between their lips and make sure like, is your Toothpillow in, because they really do adapt over it. So in the beginning, it does throw parents off. We will get questions like, hey, their lips are supposed to be closed, but I just assure them like they're breathing through their nose, which is this first part of it, along with your myofunctional therapy and tethered tissue releases. We are going to get there. It's just going to take time.
So over time, the lips will close and you won't see the appliance when the child's sleeping.
Yes.
So the appliance, it's habit corrector. So it can be part of a myofunctional therapy program because it's like I've heard of passive
Yes.
myofunctional therapy. Okay. It's challenging the lips to close, especially when that child's awake wearing it. It's presenting a challenge for them to have to wrap their lips. So it's stretching muscles. And as long as there's some conscious awareness, I think, of trying to close the lips, it can help with that.
Right.
So for habit correctors / growth guidance appliances for children, do you always recommend combining them with myofunctional therapy?
Oh, absolutely. I mean, some parents, as you know, cost is everything. Even with the discounted costs that people could get through doing teledentistry in office, we always get, well, do I have to do it's like, absolutely. What I love to tell parents is, listen, if you want the results that you see me post on social media, where it looks like this child had braces and they never saw braces, you have to follow my prescription, which is nasal hygiene, myofunctional therapy, releases if you need releases, and wearing your guidance appliance. So I do feel for parents though, the cost of orthodontics is very, very high. You have 3 or 4 kids between the ages of 3 and 6, and I'm telling you, they all need guidance appliances. They all need myofunctional therapy. I just help them to say, in my experience, age trumps and then symptoms. So if we have to pick which child to start first, that's how I guide them. But ultimately, I recommend it for every single guidance patient.
And how did you learn about myofunctional therapy?
I learned about it from my hygienist at first, but then as I was taking more courses in 2018, 2019, it was coming up. It was not as popular as it is now by any means, but my hygienist was seeing me do this Airway stuff, and she ended up taking a big course in Dallas. It's 5, 6 years ago now, and having her in office with me was an absolute game changer. I cannot even tell you, there are so many limitations to what the guidance appliances can do all by themselves in a child that has major oral dysfunction. And I'm not the expert in that. I tell parents, I cannot watch that swallow and tongue posture and function and accurately tell you they're doing well or not. We need a myofunctional therapist for that. So it changed the game for me. And it became this thing where I was like, okay, if we're struggling, if we're spitting it out at night, if we feel like we can't breathe well with it, or we can't swallow with it because we're afraid or whatever, we need to have somebody that is trained in how to fix that for the kids. And she is just my heart and soul.
Yeah, to help parents understand, it's almost like think of a child with a club foot, and you want to treat that like thinking Airway. You want to treat that. We're not going to ignore that. That's just more visible. And you might put a brace on that, but you also need to combine that with physical therapy, right? Stretching, movements.
Yes.
It's really important to add that active therapeutic techniques of myofunctional therapy, because myofunctional therapy is not just close your lips. We stretch, we strengthen, we increase range of motion. We're addressing tethered oral tissues, swallowing, chewing, function. And one of your other lectures, it started function first, what everyone gets wrong about Toothpillow. So this is like a perfect segue to Toothpillow. So what is Toothpillow? Let's talk about that. What is it?
Thank you. Hopefully it will be my legacy is what it is, because I, as you know, have such passion for increasing the awareness of this issue, first and foremost, going straight to the moms. And I had experience with that actually in my practice, because there were a number of years where these mom Facebook groups in these neighborhoods, I started getting recommended over and over and over. And again, I'm like hiding at my office. I'm like, I got these things that I don't know, wear it at night. We'll see what happens. Maybe your ADHD will go away. You know, like I had just like so much that was going on. And they single-handedly grew my practice to a level that I needed to renovate and bring more dentists in. And it was a beautiful thing. And as my experience increased with the guidance appliances, along with my confidence, my wait list became unreal. Like I mean, you have a 10-year-old boy wetting the bed that needs expanders and guidance therapy, but they can't see me for 4 months. I mean, that's really starting to be a problem. And I, along with the current president and CEO, I was approached by them on this idea of what if we could bring these appliances through a dentist, somebody who's been screened, not just click here and buy, everybody gets the same thing, but bring it straight to families, because dentists can be tricky to navigate and train. And I'll be retired probably by the time every single patient is aware of what's going on in our kids with sleep disorder breathing. I mean, it's a massive issue. And so we set out to figure out if this was something that we could do legally, all that stuff. And what I like to answer when somebody says, what's Toothpillow? It is a virtual dental office in the sky. That's what I have to say. It's not a proprietary appliance. I didn't go invent something. A lot of people think I did. A lot of people think that this is something that I like designed or whatever, and I'm sending out. We are using Vivos guides and MyoBrace appliances based on whatever the need is of the patient. And it's been so much fun. I'll tell you a little bit about how children kind of get screened for it or whatever. It's been growing organically through word of mouth and social media. We started 3 years ago, and we're treating friends and family, and in states where we had dentists that could cover for almost nothing. I mean, it cost us money, but it was R&D, right? It's like for us to like figuring out what we need to do, what our patient experience was going to be like. At the Airway dentist, we completely obsess on the patient experience. I want the second you walk into the practice to be acknowledged, smiled at. Everybody knows what it's like to walk into a doctor's office and nobody even looks up from their computer. And so as much as I was obsessing about what the in-person experience was going to be, we needed to obsess about what the virtual experience was going to be. For one, these patients weren't going to actually sit knee to knee to me, feel my love, feel my like passion for this, and say yes to treatment. So how can we get them to understand how important it is that they find somebody if they're denied for virtual care, or accept virtual care because their child is 3 or 4 or 5, and this is a perfect segue into whatever their future orthodontics will be. So we set out to do that, and I started interviewing the most incredible airway dentists across the United States. I had just gotten to know a lot of people like you, and just the doors that open. Airway is small. It's small, but we find each other. And I wanted to make sure that whoever I asked to come join this crazy target's going to be huge on your back mission had actually done appliances and knew how to talk to moms. Because I was like, if you can't talk to moms about this because you haven't done very many in your practice, like we're going to crash and burn. So yeah, it's basically teledentistry and screening for airway.
Okay, teledentistry and screening for airway. It's virtual dental office. So let's talk about this a little deeper, because I think people think Toothpillow is an appliance. I want my kid to have a Toothpillow. Put in your Toothpillow. It's like, no, let's get this out there. Toothpillow is not an appliance. You utilize appliances like Vivos guides and MyoBrace, but Toothpillow is a program. Is that correct?
Okay. Absolutely.
It's a program. So it's a program. And what does this program do? What are the steps in this program? You said age is 3, 4. What's the youngest age, and how does it work?
Yeah. So if you go to our website at toothpillow.com, you'll see we obsessed about that too, because we're like, we have to tell a story that hopefully would relate to a family of something their child is dealing with, so that they can think, is this airway? Is this something I need to talk to a dentist about? So you can actually submit your child for an assessment. Myself and Dr. Ben Moralia, who are the chief dental officers for Toothpillow, we literally screen over 2,000 children every single month right now. I want people to understand the volume, that this is insane for us. It is a full-time job. It's 2 full-time jobs actually on top of everything else we're doing.
Just the 2 of you screen, or
every single one of those? No, We are the yes or no to whether or not it's appropriate, because this company is our baby. And what I mean is yes or no to whether it's appropriate is we've done so many cases. We know which will be successful with guidance therapy if the child and the family follows our prescription and does the myo and does the nasal hygiene and all the stuff we're talking about. And we know the ones that immediately need to be seen in office. And we have people hired specifically for those denials, which I want people to hear the word denials, so that we can get these children into the right offices across the United States, which is really heartbreaking, Nicole, to deny these children, because they are usually in very rural areas where going to anybody with this kind of training is a day's car ride, right? But we would never sell them a product or a treatment that we did not think was going to work for them. And that's the part that takes the expertise that Dr. Morali and I have to say yes or no to these families.
Why would someone get denied?
Severity. Because if you are, even 8, I will tell you that we probably deny over 50% of the children who submit between the ages of 10 and 12. Because as you know, the growth that has already happened to that point is massive. And we firmly believe that that requires expansion with custom expanders in office and that sort of oversight. There are times that we have denied a 4-year-old, we have denied 8-year-olds. Like we have seen, when you screen this many children, you are seeing things that the dentists that they're not even seeing have never seen. And missing teeth, like all sorts of stuff. And we need to make sure that they get in the right hands. And the public is really looking to us right now as the experts of that decision process. And that's where I want people to know that this is not just like, click here, we're going to charge you $2,000. Our program is $2,000. That does not include myofunctional therapy. So even that is outside of these families' budgets. But we're not going to charge you that if we do not think this is going to be a success.
Okay, so if someone submits the case, they go to the website, the parent submits the case. So I assume you have certain questions, and do they upload?
Absolutely. We have the pediatric sleep questionnaire, a full medical history. I need to know everything they want me to know about their child. Like if they were sitting in the office with me, I need it all written down. We will pause the yes or no decision if we do not have enough information, panoramic radiograph, CT, whatever. If we're worried that these children are going to be approved, but we need, more information, we will wait and get that information.
Okay, quick question then. So when they're submitting, they have to submit images also?
Absolutely. Yeah. And if they don't have it right then and there on hand, I will take their ortho photos. I will accept their medical history. I will read through everything else, but we're going to be sitting, especially on the older children. The 3 and 4-year-olds, I might not be quite as picky on with that because I know we have time and I can say, go in and get it done, submit it to us to look at, whatever. But on the older ones, it's critical. I've got to make sure we don't have blocked out canines. I've got to make sure that the parents actually understand the urgency of that age group, because it's like, here's your window. Here's your window when it's going to be the most cost effective to go in and have treatment done before you're fully grown.
So most of these parents submitting already have a dentist or an orthodontist, because they're going to need to get the images and the orthodontic photos
They
done,
at least
right?
have a dentist. You would be shocked how many though will tell me we've never seen one. It's like a 7-year-old kid. I'm looking at, I don't see cavities a lot. Sometimes we do. Sometimes I'm like, I'm so sorry. You got to get all that taken care of before you can come in and do this, because like this is a liability. But you would be shocked how many just have never gone. And it's like, okay, well, now the burden is on me to not only educate them on this sleep disorder breathing and the symptoms that they're seeing, but encourage them to go get an office consultation. And because I have dentists in every single state, I have somebody that I can immediately recommend that at least knows what a guidance appliance is, right? That's working for me. Because as you can probably imagine, they end up in the wrong office who's never heard of myofunctional therapy. They've never heard of a guided growth appliance. They're going to just roll their eyes at, which has happened. They'll roll their eyes at the DOB. Absolutely don't do that. Like they don't. And it's like, I get so frustrated with that because they have no clue the severity of that decision that they just made to that family. By saying that, they're so uneducated. I was teaching on Monday about this levels of competence, and an unconscious incompetent is the most dangerous. And that is what's happening when they say, oh yeah, you shouldn't believe anything at Toothpillow, or you should never wear that appliance. It's like, you were never trained on it and you shouldn't have an opinion on it either.
Exactly. Yeah, no. Yeah, I totally agree. We should not speak about things that we don't fully know or understand, because you are just misguiding people if you're speaking up and you don't have the information. So if I'm a parent and this is sounding really exciting to me. So I want to enroll my child, submit their case. I would probably have to go to my dentist and say, oh, can you do x-rays or some sort of imaging? Because you're going to want updated information if my child hasn't been there for a few months or they haven't had their x-rays for a year or whatever. So you would go get all that taken care of, submit online. And then what's the next step? You and Dr. Moralia are screening these cases. And then what happens?
So once we've approved the case for treatment, it is sent to the state level treating provider. Okay. So just like the logistics of the legality of it. So once it's sent to the treating provider, they obviously also have a say in whether or not the treatment is appropriate, and they're willing to do it because this is their patient. And they rarely disagree with us, but sometimes if they have concerns, we just address that high level at the company, right? And we talk about it. So once it's submitted to that state level treating provider, they literally sit down and record a custom Zoom video for this family on the information that they have sent in for free. Okay. This is a tremendous amount of their time because each video could be 8 to 15 minutes plus or minus. And they feel the same equal burden to explain to the parents why this is so important, whether they do it virtually with us or they go in office. We don't care. You need to do it because this is going to determine the rest of the child's life. And I am so forever grateful to our treating providers because the volume now is so high and the amount of time that they're devoting to this for us to get the information out to the families is truly remarkable. So the family will get a video. They will get a link from our success team member, whoever's assigned to their case. And they'll say, hey, Dr. Kalli has made you a video about your child. Click here to listen to it. And if you want to move forward with treatment, we'll talk cost and whatever at the end. And so that's kind of the flow. It gets submitted. We say yes or no. If it goes into the no pile, we have team members responsible for helping them find a provider. If it goes into the yes pile, it gets distributed to that state. That provider does all their things, and then the families can start treatment.
Does it cost to submit the case? For the parent to submit?
It does not cost anything for them to submit for assessment.
Wow. So the submitting and sending it to that state provider and that provider summarizing an 8 to 10 minute Zoom video about the child, there's no cost at that point. Wow. It's so amazing because that is so much time. So for our office, I'll read over the new patient paperwork, which is a lot for most of our cases, even though I might not be treating, because we all we micromanage, right? We're like, I want my input, my insight, I want to help out. So I'll do that for a lot of our cases. And that takes me like an hour to read over that, at least an hour to summarize whether I'm doing an audio recording, video recording, typing up my thoughts. It might take 2 hours. It's a lot of work. You guys are screening 2,000 kids a month and then doing that. Oh, this is a lot of time and energy.
Thank you for saying that. It is truly, it is.
Plus, we're not going to mention the 5 offices you're opening on the side. So you probably don't sleep. You're losing sleep helping all these kids. But here's the thing. I think once parents understand the information about their child, what we see as a problem, how this can impact their life, what they might already be seeing as issues, oftentimes it's hard for them to turn the treatment part down because it makes sense. So you must have amazing providers working with your company that are able to have that connection with, you said the connection with the mom or to talk to the mom or the dad. Dads are important too.
Yes.
So
yeah, totally. We are. And we had to find those people because otherwise, if you get this like really awkward video from this doctor that like doesn't really know what they're talking about, you're never going to make it successful. And it was so important to me, like so important to me that the people we had were qualified and they had to be. And these doctors all have practices and they are all working from 8 to 5. So these videos are being done in the evenings, on the weekends. Like you have to have a passion and heart for this.
We need to praise, you do. Praise these doctors, praise all these Airway people who are putting their time in. And so at that point, I assume parents, they have this video and then they start sharing it with their friends, with their current dentist, maybe an orthodontist. They're getting other opinions. What do we do?
They are
so,
there.
Right. So there might be some lag or some parents might hop on the treatment right away. So those who are ready to start a treatment, what is the cost? How does that work? And what are the next steps?
Yeah, so our main fee right now is $19.99, I believe, or $2,000 for 24 months of oversight virtually within our program. The myofunctional therapy is an add-on of $1,000, which most people combine, I think they get like a little bit of a discount. So if they do the full Myo program with the Toothpillow program, it is $3,000 to start treatment. And we can get into the Myo side of it at a little bit later. But the 24 months means lots of oversight and communication between their success manager and the treating provider. And we have a beautiful app. Everything is HIPAA compliant. We have online operating software for all their photos, and the patients have really unfiltered 24/7 access to their teeth.
You are a go-getter. This is a
Thank
smart
you.
way to reach so many children. So the 24 month, is that the entire program that the child's going to need for this
For
early?
that price, So we had, and I learned this the hard way in private practice when I first started. I had 500, 750 cases, and I had never told the parents what they had paid me for, like how long that was going to last. And like at that point, how long am I doing the treatment for free? Like we're 5-6 years in. Are we still not paying at least an office visit or something, you know? And so I knew going into building Toothpillow, there had to be a timeline. That doesn't mean they're done. Definitely doesn't mean they're done, but we're given the patient, we do like a graduation conversation where everything gets resubmitted, any new x-rays, their sleep questionnaires, all of that, and a nice collage before and after of how their bite's doing and their symptoms are doing from starting the program. And then the dentist, the treating provider will decide, does the child still need treatment? And if they started at 5 or 6, then yes, like we'd like you to keep wearing it. If they're older and they need to be referred now for expanders or ortho, clear aligners, braces, whatever, we will put that in their graduation certificate so they can understand what their next steps are. So the ones that choose to stay on, there's a monthly fee they pay for that. It's very low. It just gives them access in the app and to continue to take pictures, and they can message their dentist and all that good stuff.
Yeah, that sounds like that would be desirable to continue having that connection. There's so many social media groups and posts of parent groups asking each other questions, and every once in a while a provider will pop in, but to have that direct connection, I would feel like is important. So how is a child fitted for the appliance? And how do you determine which appliance of, maybe it sounds like you're doing the Vivos guides and the MyoBrace, how do you determine which the child needs?
Yeah, so it's really nice because both of those systems have starter appliances that are based on what teeth you have in your mouth. So it makes it really simple. Our protocols are that everybody goes through one of those starter appliances. The Vivos starter kids and the Vivos starter for our normal class 1, class 2 deep bite cases are gold. The MyoBrace class 3 appliances for those anterior cross bites in class 3 cases, that is usually how we're picking. Those are kind of the doctor's 3, big options based on their occlusion, which you see easily from the photos that we take. Once they get to their second stage appliances, that's where things got tricky. And that's where we had to go to the drawing board and figure out, how can I remotely measure these kids' palates and teeth? And we figured it out. So we have a measuring card that they use, and a special sticker they have to put on the tooth, which like the computer reads and knows the diameter of that. So we can figure out 7 through 10 measurements and molar measurements. I'm very proud of that ruler, actually. I'm like, this is very good. And then that's how we determine what second stage appliance they're going to need as they go through treatment. But the beginning is easy. If they're all primary dentition, it's very obvious. If they have their first molars present, then they'll be in a slightly wider one. And yeah, we go from there.
Okay. And then they're in their appliances. How often is the parent consulting with their provider on, virtual, but their main provider
Right.
to switch appliances? How do they know when to do that and how?
Our app prompts them for everything. In the beginning, it's a lot, like more than it would be in private practice. We ask for weekly photos and we ask for daily check-ins. Did you do your exercises? Did you do your nasal hygiene? And did you wear your guidance appliance? And we'll ask, did it stay in all night? Yes or no? So that we can really track if they say, oh, it's not working. And then I'm like, okay, well, you never did any of the things that we were saying, like probably wearing it would get you the results, things like that. But it's really helpful because I want them to feel like we are paying attention, because we are, when they've never met us before, So again, if they just spent all this money and then they don't hear from us ever again, like that company's going to fail. Like there's no chance. Yeah. So we go from weekly photos to monthly photos, and then we do quarterly check-ins with their dentist. So the dentist is available all the time to answer a question that if it really has to be answered by the dentist, but our success managers are very qualified. They know the ins and outs of guidance therapy. I've taught them everything. They know the answers for these families. And most of the time, they're the ones that are communicating. And then they'll say, we'll pass the message to Dr. Hale if you need her or whatever, and we'll get you an answer if it's a tricky one. So so we have quite a bit of interaction with them throughout the whole treatment. Then myofunctional therapy. I mean, that is a whole different aspect to what is in the app for them. And their myofunctional therapist is vital in the entire process. And they all understand guidance appliances too. So they're really helpful for the mom when they have questions of like, oh, Johnny's still spitting it out or whatever. And the myofunctional therapy part in graduation is handled by the OMTs directly. And they, we give them whatever reins they need to make sure that the case is successful.
Okay, I definitely want to get into the myofunctional therapy part in just one second. The daily check-ins, who looks over those daily ratings? Is it an AI type thing, or is it that success manager is actually?
It is a person. It's a person. We have so many now. It's a human right now. It will get better. We've got to figure out this AI stuff. We really do. But the nice thing is it's all gathering the information. And then when something comes up, if a parent has a question or something, we're able to access that immediately. The success manager 2 weeks in can say, well, let me just look at the history. Okay. I mean, it's been staying in for the last 2 weeks. We should start to see improvements in bedwetting or this or that or whatever's going on.
And then at this point, also, if a patient's not compliant, so they're not wearing their appliance, what do you do? Do you ever drop the case?
Yeah, I hate dropping cases. Have there been some? Sure. You can't. We just surpassed last week 10,000 kids in treatment, by the way. We hit a huge milestone of kids that are literally in treatment with us virtually.
10,000 kids.
10,000. Yes.
Wow.
And I would love to sit down one day and really review the data we have. Nobody has this much data on guidance appliances. I'm telling you, like the questionnaires perfectly timed at these segments, the photos, the myo, which ones did that, which ones didn't, what kind of results did we have? Like, I need a whole team of people to start researching this so we can publish something.
That's amazing. I'm sure there's going to be a way, probably through AI, to put all the data together.
Totally.
It's going to be amazing to read the summary and the research on what's happening to these 10,000 kids, where they were then, what changes you've seen. For a non-compliant child, there's only so much you can do.
Exactly. So we typically, my go-to is if your child is not able to do what we're asking virtually, I really need you to go see a dentist. I really need you to go see your treating provider, actually. But that's so hard if they're 7 hours away. It's such a burden, the lack of airway dentists that we have to utilize. But I basically insist on it. I'm like, if you are wanting some sort of a refund, or you're upset about something, or like you just don't think this is going to work, it works every time when it's worn. That's the message I try to get them to understand. You will always be healthier after doing myofunctional therapy. You will always be healthier when you're breathing through your nose while you're sleeping. This is not a gimmick, And so we really encourage them to go see the treating provider. And if we just can't, because there's just not an option to the family, they can't, then we have to make decisions at that point. But it's our first line. Like, we are real people behind that computer, and we know what we're doing, and we want to help you.
Well, same with being a myofunctional therapist. If you have a non-compliant patient, you have to explain to them or the parents what's going on, make sure they understand the reason. Us as providers have to be flexible and figure out, why is that person not compliant? There's maybe a reason. Is it uncomfortable? Is it not fitting into their schedule correctly of what exercise they need to do? How do we modify and adjust? But of course, there's only so much we can do. And you talked about this Toothpillow program is appropriate age 3, but up to age 10 to 12 years old, 50% of the cases are going to get denied, because that's when something more aggressive is going to be needed.
Absolutely.
The bones are firming up, the sutures are intertwining, and a guidance appliance is not going to be as appropriate. So now let's talk about myofunctional therapy. How is that incorporated into this Toothpillow program?
Yeah, so we have 2 incredible directors of Myo. I was very excited when they joined us, because I knew that they would do a wonderful job in not only training, because they both train outside of Toothpillow, but bringing more Myos into Toothpillow Virtual so that we could help these kids. Our volume, I think it is the largest myofunctional therapy program in the world. I do. Our volume of 300 to 400 at least cases of Myo starting every single month is a massive undertaking for these Myos. And so don't quote me, but I think we have 38 myofunctional therapists within our group right now, but it just continues to grow. And we have Brittany Murphy and Laura Eckhart that are running as the directors of the program, and a wonderful success manager named Savannah, who manages all the initial consults for the patients, booking it, all that good stuff. So Myo is heavily promoted and educated on in our Toothpillow Instagram. If if you've seen the _official Instagram, you will see how much effort we go and the money we spend to have graphics made to help these families understand what the heck myofunctional therapy even is. And I love it. I named, and when I was in the World Dental Sleep Society in San Francisco 2 years ago, I did a little lunch and learn them, and I called it "What the Heck is Toothpillow?" because I just felt like we needed to have a "What the Heck is Toothpillow" seminar. And now it's like the amount of people that know what myofunctional therapy is because social media has helped us to spread that message just warms my heart.
Yeah, really spreading the information about myofunctional therapy. You can't go wrong with that. Like, we need to get that word out. And I think so many more people know about myofunctional therapy now than they did 3, 5 years ago,
Oh,
even. And there's
absolutely.
so many more
Absolutely.
providers. So are the
Mhm.
myofunctional therapists, speech pathologists, dental hygienists, both
I
providers?
believe most are RDH OMTs, but I couldn't tell you. I mean, I just totally put it in the hands of our directors, and they are hand selecting the ones that are appropriate for the job.
Okay. And the
So good choice.
myofunctional therapy, is that all virtual?
It is, however, the families who are near these myos can opt to actually go see them. Again, it's an access to care issue, all of it. We are treating so many people that just literally would never be able to find a dentist or drive to a dentist frequently to have a tooth pillow, or whatever, or have myo. So but our myos, I mean, trust me, we would all prefer in office. Like, they love being in office with the kids, but it's just not feasible at this volume. Like, we just have to let the families decide, how they want to do it.
And how do you pick the myofunctional therapists who are qualified to be in Toothpillow?
Well, it usually they've been trained by either Brittany or Laura, but they do a very big vetting process. Like, they interview every single one. We have so many requests from myos to join Toothpillow, which warms my heart. We want to make it a profitable and wonderful place to work and be able to help more kids than they would be able to help on their own normally. And they are just hand selected and interviewed by our directors.
Okay. And what if a parent does not want to do the myofunctional therapy portion of Toothpillow?
Yeah, I mean, they can take it off. They don't have to pay for it. I mean, same within my office. Like, if they just want a guidance appliance for expanders and they decline doing myo, they just are given a pretty hefty informational speech by myself or whoever at Toothpillow that the results are probably not going to be the same. But it is honestly, it's so hard to see the financial struggles that these families have, even at our price point, which is like half of what they would pay to come see me in office, right? And it's like a matter of not undercutting the system either, but like, we have bills that we have to pay and people we have to pay to be able to do this. And that's about as cheap as we can get with the treatment. And even that is difficult for some families. So
Yeah, I was
it's
going to
hard.
ask,
It's
does
hard.
insurance cover this at all?
We actually do have somebody who is specialized in reimbursement who has been working really hard the last 90 days to figure out whether or not families can seek reimbursement on their own. We are not accepting payments from insurance ourselves because we just cannot. Like, you're just going to have to pay us, and then if you get reimbursed, great. It's a little different in dental offices. Obviously, we are able to help them bill with orthodontic benefits in office, but the virtual stuff is like really tricky. But we're trying. We have somebody on payroll trying to help figure it out for us.
Yeah, I bet at some
Yeah,
point there will be a way, or you will find a way. I know with other
we will.
therapies, certain insurances do cover virtual, especially after COVID, and now insurance are taking
Yes.
away telemedicine. So I know it
Right.
can be tricky. And also, I know patients who need double jaw surgery, insurance might not cover it if it's cosmetic, but if they have a sleep apnea diagnosis, they might. So,
Right.
maybe that route might
Yes.
help.
And we do have a pediatric sleep physician that is with us in Toothpillow. He's incredible, Dr. Valenzuela. And he is offering, he's part of the, I think my child needs a sleep study. Okay, he's going to send it. You're going to do a consultation with him. And yeah, so we didn't even really get to that part, but I have some incredible physicians that are working with us at Toothpillow to help make sure we can link families, again, ones that don't have access to the best ENT or the best sleep physician, that they can still get on Zoom and talk to these people and get answers for their child.
Yeah, I could see maybe the Toothpillow program, since you have the audience, families, and you have so many providers, potentially at one point adding ENT consultations, allergy, things like that, sleep
Absolutely, we are.
to the program. Ah, I'm like
Yeah.
giving away my thought, which I know you already had that. Sure. Okay, so
Thank you.
are these
Yes.
providers dentists or orthodontists?
So we have a mix, actually. We have a mix. So I would say the majority of them that are monitoring the 24 months with guidance appliances only are general dentists that are heavily trained in Airway. But we are, as people have been noticing on social media, increasing our ages now to have some other options for teens, adults. All of that will go through offices. And we have some incredible orthodontists that are going to be working with us at that. I'm very excited. So the patients will be led to their practices to have proper scans and diagnoses and all that good stuff that you have to have, obviously, if you're grown and you're an adult, but they're still going to have a lot of the benefits of the virtual aspect of the Toothpillow company.
Have you seen any negative comments or feedback from orthodontists who might be like, what is this virtual? You need to be treated in my office. I'm an orthodontist. What are these people doing?
I don't know how many orthodontists actually know we exist.
Okay.
I am just at this point, I look at the naysayers as noise, and I have so much going on, as you can imagine, that I'm like, I know my heart. I know why this company was built, and we are helping people. But the ones that are Airway orthos love it. I mean, like Dr. Lucas told me more times than not, like, what a beautiful idea. And he's such an incredible Airway orthodontist. He just is, he's amazing. But I will tell you a story. So I spoke at the 88th. Steve Carstensen asked me to come and speak at the Children's Health Initiative event. He gave me the entire Thursday. And I actually wasn't talking on treatment. I was talking on patient acceptance and flow and motivating the doctors and just kind of for in-office stuff. But there was a gentleman in the audience that really tried hard to get me in the Q&A, and he was very frustrated. He just wanted to see if he could trip me up, and said his piece.
Dr. Kalli Hale does not get tripped up. I know that.
I mean, I'm just like, I don't know. I think the confidence just comes with experience, and I have to look at everything through the lens of nobody wants to think they've done anything wrong. I obviously am not a proponent of pulling bicuspids as who I am. Let's expand the jaws, right? But I have done that. Like I literally did that as a new dentist because I got a letter in the mail from the orthodontist and they said, pull the bice, pull the bice. Like it was just like, okay, we just do it. Right. So I always try to look at people who might be very skeptical of what I've built and what I'm doing, just through the lens of like, they actually don't understand it. And I can only let people hurt me that I will let people hurt me. Right. And so I really was as respectful as I could have been to the guy. Dr. Carstensen came up to me afterwards. He's like, you did very well. That was rough. And I was like, yes, it was. Thank you. Because I mean, there's no need to be ugly or nasty or anything like that. And he wasn't. He just was very passionate. I've decided, Nicole, that orthodontics is a religion. That's what I've decided.
I hear you. I was interviewing Dr. Yousefian.
Great interview. Great interview. I listened to it. Of course I did. Oh,
and it was so amazing at the end how he sees orthodontics as going into two different fields or specialty areas. One cosmetic focused and one more medically based airway sleep medicine.
Beautiful. Couldn't agree more.
That's a great way to handle that dilemma or difference in opinions on treatment and purpose. So that person who may be speaking to you might have one school of thought that's just a different.
Absolutely.
Right. So, okay. So you said you're going to have a target on your back. A lot of Airway people do, but you need to have tough armor like you have. And you're going to hear all this, you need a white noise machine. You need armor and white noise machine as you continue your mission. So I think this is so amazing. Is there anything you would have done differently knowing what you know now, starting the Toothpillow program? That's a really tough question. Sorry to throw that on you when we have.
These are good. These are good questions. What I would have done differently in the beginning is I probably would have had more conversations with more people about what we really were, because while we were doing everything we could to build the company, so we're drowning anyway in funding and getting it built and the nitty-gritty of what we wanted this to be. There could have been more conversations happening, whether it was me by myself on social media or something, just explaining what was coming and what we were doing. What ended up happening is a very well-known nurse practitioner posted about us, and almost overnight we went viral. And we had like a weekend where we had over 2,000, I think, 1,800, something crazy. We had never had volume like that before, like ever. And then everybody came out. It was like, wait,
what is this?
Yes. Yeah. And so then it was a matter of just kind of like, you don't know what you don't know. I mean, building a giant virtual company where like everybody on social media is going to talk to you, talk about you, have an opinion about you, decide things about you. Like we just had, okay, here we go, but that's why I did that. I did the myth slide at WDSS, and I did the what the heck is Toothpillow, because I was hoping that the cream of the crop at that meeting would have a little more grace for what they wanted to try to say about us behind the scenes.
Yeah,
And it was actually very well received.
and I could see if people don't know what this is and what population this can apply to, they might think some virtual company is coming in to steal their patients, some easy way out. So
100%.
knowing the background of what your purpose is, all the effort it's taking probably changes people's thoughts who maybe were unaware,
So,
because you're
yes.
reaching those people who probably wouldn't get help or
Right.
might not be able to have access to care or might not think
Totally.
it's
I
important.
mean, absolutely. And I try to tell people, because it's not that I didn't ever think that either. Like, oh, everybody's just going to go online now to get me cheaper or whatever. But the fact of the matter is, this is so much bigger than me. Like, there's no chance I could treat the volume that we're treating virtually every month in my practice by myself. There's no chance. And so I think when you can look at it from a perspective of these kids wouldn't have found you, and so many are actually not going virtual, and they're finding an airway dentist in their town because they want to meet them and talk to them. So like, we're bringing more patients into practice all over the United States than people even realize, because they're wondering what's a Toothpillow.
Yeah. And I think we all probably agree that if you have an in-office option and a parent can bring their child in office, that's always going to be preferable. And
100%.
yeah, same with myofunctional therapy. I rarely
Yes.
allow virtual cases. There has to be a specific reason why you can't come to see me. And totally, we'll do virtual. That's fine. Especially for adults, it's going to be easier. But if a parent says they're close and they want to come to the office and they can, we're always going to promote that with
Yes.
our own practice. So I'm sure it's bringing patients into offices, seeing providers, but as a backup, if they can't, they have this virtual aspect to your program. And I probably have 10 more questions I can ask you at least, but we have 1 minute till we're at the end of our marketing. You got to board a plane to teach more people.
I do.
I really thank you so much for all of your time and all that you do. Everything with starting this program to reach so many more people. 10,000 children have been part of the program at this point. Plus, you have 4 offices, 5 more opening, 9 offices around Texas. You are really an airway advocate spreading this message. So thank you for all you do and for being here with me.
It's my pleasure, Nicole. I am just so happy we finally did this, and I hope to hug you at a meeting soon whenever we can run into each other. Yes. But I'm so proud of you. And seriously, your message and the way you speak, you are so clear. You have such beautiful facts when you are up there. And I hope that you are very fulfilled by that, because it's a calling for you for sure.
Oh, thank you so much. And that gives me energy. Doing this gives me energy like it does for you. Otherwise, we wouldn't be able to do this. And I remember reading us saying, where passion meets purpose, you are unstoppable. So let's keep this.
Oh, it gave me chills. It's so true. It's so true. Yes.
So there we go. Well, enjoy. Have a safe flight and keep
Thanks,
up the
Kalli.
great work. Thank you.
Thanks for having me. Bye.
Thank you so much for joining this episode of Airway Answers. I'm hoping some of your airway questions were answered. Please feel free to give us a rating or a comment. And if you have any further questions, you're welcome to email me at nicole@airwayanswers.info or check out our site at www.airwayanswers.info. Thank you so much and join us for the next one.